me to just perfect. Can you see my screen?
Yes, Doctor.
Okay, sawa. So I'd like us to begin with, I just want to hear from you. When you hear the word quality or quality improvement, just put down whatever comes down, what comes to your head, whether it's a word, a phrase, several things, whatever it is, when you hear the word quality or you see the word quality or quality improvement. What pops up in your mind? It's like 5 minutes to read them out before we proceed to our next slide. Any inputs?
Not yet.
Not yet. What comes to your mind when you hear the word quality?
Standards.
Standards.
Okay. They are coming, meeting standards, high standards achievable. Acceptable. Superior. Safety by activity that ensure organization function well. Standard and sustainable.
Okay, good. Yes. Thank you for that. So, well, the definitions of quality improvement vary, and quality is defined differently and determined by whoever is defining it. The user determines what quality is by their standard. Okay, so there is a wide definition of quality, but quality improvement is a framework. It's a framework that we use to systematically improve healthcare, right? And it involves us identifying our problems, testing ideas of change to improve on that problem, and measuring our results against our goal. Yeah. Just take note that for us to improve, there has to be a change. For anything to improve, there has to be a change. Things cannot be done the same way every time to achieve a different outcome. So remember that all improvements require change. That is the key word, take home message. But not all those changes will bring about an improvement, right? So quality improvement, it can be brought about by a combination of both technical and behavioral skills, meaning we change our habits, making things a culture, having the right tools, the right knowledge. So it is a combination, and it comprises of tools, the techniques, the frameworks, which we're going to be introduced to today, for systematically improving these processes within our systems so that we can have optimal results. So I just another pause. What are the kind of problems that we face in our health system? If you're a healthcare worker, for example, what are the common things that we list as problems in our health system? Let's take another 30 seconds or so and just jot down our answers.
Congestion.
Congestion.
Yes. Commodity stock out, high workload.
Good.
Poor
I
documentation
didn't
in
hear
data
the famous
collection.
one.
There's another one
Mhm.
here. Poor documentation in data collection tools.
Right,
Negative attitude, knowledge gap.
right. Great.
Yes.
Perfect, perfect. Thank you, thank you. Keep them coming. Let's interact as much as possible. So, my laptop has decided to hang. Is my screen moving?
Not yet.
Not yet. Okay,
Yes.
now?
Now, yes. It is.
Okay, perfect. So whatever you've mentioned plus more, we have so many problems in the health system. And that is why we are saying that we can use the quality improvement process, a systematic way of approaching, identifying our problem, defining it, finding solutions to it, yeah, and measuring our results against our goals. So I didn't hear anybody mentioning shortage of human resource. Our
They
biggest
said
burden,
workload.
workload, high workload. Yes.
Yes.
So you can see this man carrying a load of problems on their back. Yeah. So when we talk about stepwise improvement, where does it start from? And I want to say, and take notes, it starts with a positive mindset. That is the first step to an improvement. Why am I saying that? Because whenever you want to bring about change, comes with resistance. But why resistance? Because people tend to be afraid of change, yeah, doing things differently. But with a positive mindset, you are able to look at your problem in a different way. Think outside the box. Do you see these people on the right side? They're having the same problem, but with a positive mindset, they think outside the box, have a bunch of ideas, and are prepared to solve these problems. But with a negative mindset, you'll always be thinking the same way, saying, why we've always been doing things like this? Why do things any other way? Yeah. So we need to start changing first and foremost our mindsets. So even with a positive thinker, even if you have a positive set, don't have necessary tools help you to that problem or break that wall. Yeah. You will not be able to achieve your goals. So we're going to talk about our tool, the tool that we're going to use, the approach that we're going to employ in quality improvement, that is called 5S TQM, Kaizen TQM approach. And I'll elaborate further as we go on. So the 5S Kaizen TQM approach originated from Japan. There are so many quality improvement models. For those who are familiar with quality improvement. However, in Kenya, we by the Kenya Quality Model for Health, which entails the 5S Kaizen TQ model. So what is improvement in your physical environment? The physical space where you work, you need to improve it, meaning eliminating clutter, arranging things in optimal manner, and being able to work in a clean environment. So 5S, it is applicable. Can I hear from you? Can you write in the chat, where can you apply 5S? In the health department. Mind you, 5S is applicable even in the home. Yeah. So where can we apply 5S? Which sections of the health department can we apply 5S? Are we getting any answers?
Yes,
Where can we,
in the
where
workplace,
can we improve?
everywhere, arrangement of commodity in the store, IPC sanitation, work environment, every department you can apply 5S, even at
Okay.
home.
Great.
Yes.
Okay. So perfect. 5S is the office stations, to the stores, to the dispensing areas, to the lobbies, anywhere, name it, even in the drawers. Okay. And the first webinar we had was on 5S by Dr. Karima. For those who missed it, feel free to follow the YouTube channel and you will find it there. I think it will be displayed at the end of the webinar by our Christine, kindly mute.
Excuse me, let's mute.
Okay, so we proceed. Next is Kaizen. What is Kaizen? Kaizen is a Japanese word. It's broken down into Kai, which means change, and Zen means better. So it's in short, it is change for the better. Okay. So what does it entail? We use it interchangeably here with the term continuous quality improvement. So when we say Kaizen, we're meaning continuous quality improvement. When you hear CQI and you hear someone say Kaizen, we use it interchangeably. And what is it? It is basically problem solving, solving those problems which we have mentioned before, those that we know, those we identified. We solve them, sustain the gains, and move on to the next problem solving. And it is a continuous cycle. The key word here, it is continuous. Continuous quality improvement. So you're solving one problem, finishing with that, sustaining gains, and moving to the next. And when you do 5S plus Kaizen continuously, yeah, over several cycles, it equals total quality management. This means all the departments are well organized. All your problems, or almost all your problems, have been solved at the level which each healthcare worker is working. So just a pictorial to summarize what we've been talking about. So we want to achieve a holistic change, yeah? And what did we say we begin with here, right here? We begin with a Kaizen mind, a positive mindset. That is the seed we want to plant. We want to plant the seed of a positive mindset, combined now with the beginning of boosting, creating a good physical work environment, whereby you're having a good leadership commitment, yeah, managerial support. And what will be the fruits of this? Yeah, we continue with a positive mindset, begin solving the problems, and that is where you're moving now to Kaizen. Yeah, and after you do continuous 5S and Kaizen, you will find that the organization is functioning at optimal levels. Optimal levels, yeah? Increased productivity, increased safety, high level of satisfaction for both employees and patients. Yeah? So it's important, since we are solving our problems, to be able to do what? To define and understand these problems. So what is a problem to begin with? Yeah? And this pictorial just tells you it is that gap between where you are, that is the current situation, versus where do you want to be, or the ideal situation, as some people would say, the standard, right? So you will find that this here is your problem. Problems can be big, they can be small. And as you can see here, the smaller problems require minimal assistance to solve. And you can see this guy here is jumping from the current situation to the ideal situation very easily. It's just a small gap, very easy to fill. But there are those bigger problems, those heavier ones, yeah, where